offer collaboration for medical assistance and disaster relief in Los Angeles, an area of our country that has seen some of the greatest impact from the coronavirus pandemic. We will be ready on arrival to support FEMA, state, and local agencies' efforts to protect the health of the American people and the whole of government approach directed by the President of the United States. This global crisis demands a whole of government response, and we are ready to support. Mercy brings a team of medical professionals, medical equipment, and supplies, all of which will act in essence as a relief valve for local civilian hospitals in the Los Angeles area, so that local health professionals can better focus on COVID-19 cases. We are not deploying to treat COVID-19 patients and are taking proactive measures to ensure anyone coming aboard is properly screened for COVID-19 to mitigate the risk of a case on board. Mercy operates as an afloat hospital and has infection control procedures that will be followed just as any hospital ashore. We will use our agility and responsiveness as an afloat medical treatment facility to do what the country asks and bring relief where needed most. Our hospital ships are uniquely outfitted for humanitarian assistance and disaster relief, one of the Navy's core missions that these ships perform around the world. The men and women of the U.S. Navy Mercy team are highly skilled, highly trained, and anxious to assist our communities in support of the COVID-19 response efforts. Here with Rear Admiral Weber and I is Captain Dan Cobian, Commander of Destroyer Squadron 21 and this mission's commander, and Captain John Olmsted, the ship's Civil Service Master, and we're ready for any questions that you may have at this time. So thank you for that question. From what I've seen walking around the ship as people come aboard and so forth as we get ready, enthusiasm is very high for this mission. This is exactly what Navy medicine trains to do, and we are ready to execute.
I've got a question for Admiral Weber, Andrew Dyer from the Union Tribune. Sir, my question is, do you have a number of cases of sailors on this waterfront positive for COVID-19? Why isn't the Navy testing more sailors for this virus?
Do I have a specific number on the waterfront? No, I don't.
It's 10 at last count, sir.
Okay, well, thank you for that. So when it comes to talk about testing, our number one priority is to protect our people and prevent disease. Navy medicine does that every day at the waterfront and cares for our beneficiaries. We also follow current CDC guidelines closely, working with our Navy and Marine Corps Public Health Command. Those CDC guidelines talk about if someone is ill, the first thing they should do is stay home and they should call their provider. If they're symptomatic, then they should self-quarantine. If they have those symptoms, if those symptoms go away after 72 hours, that is a good check and block to return to work. Also, 7 days have to pass since the onset of those symptoms, and then any respiratory systems have to abate. So, I say that because Navy medicine, military medicine, follow CDC guidelines, and CDC guidelines don't say test everyone. The nice thing about the algorithm of the CDC is that it also includes trained, skilled providers to make a judgment call based on the symptomology and the background and history of that patient. Thank you.
We anticipate beginning to see patients the day after we arrive in Los Angeles. When we first arrive why we're going to bring on some additional folks and some additional medical supplies.
How many beds?
Total of 1,000 beds.
And what day do you think you'll arrive?
We anticipate arriving within the week.
Steve Walsh, thank you again. You're not going to treat COVID-19 patients. Why is that? And what are your limitations? What can and what can't you do?
So we offer a very broad range of both medical and surgical capability on the ship. And again, the intent is for us to act as a relief valve for the local hospitals so that they can focus their efforts and resources on treating COVID-19 patients. So we expect to see a broad range of medical and surgical patients. We're not bringing patients aboard to do elective surgeries. As you know, most hospitals around the country have slowed down or stopped doing elective surgeries in order to conserve resources and also protect the health of their workforce.
How many operating rooms are there?
We have a total of 12 operating rooms on the ship. For the specific mission that we're doing, we're only planning to staff 9 because we think that will meet the requirement for our inpatients.
What do you think your mission will be? What are you going to see?
Whatever goes into a local hospital, it could be someone with pneumonia, it could be somebody with a broken leg. We will not be taking trauma directly to the ship, but a patient that has been exposed to trauma of some sort, like a motor vehicle accident, we may take that patient and transfer and continue their follow-on care. So very broad range of medical and surgical issues.
And briefly, why not COVID-19? Was that the issue that we're dealing with?
That was the mission as directed to us by the President.
Thank you. The question was about logistics, what pier and what port. We are pulling into the port of Los Angeles. The final decision on the pier is yet to be determined. There's a lot of work going towards this to make sure we get where we're needed and where it makes sense logistically. Regarding the transfer of personnel and patients, I'm going to defer to the MTF captain.
Captain Dan Kogan.
So we anticipate that most transfers will be by ground. In reality, that's how most hospitals transport patients from one to the other. We certainly have a flight deck and are air capable, but we anticipate that the vast majority will be ground transport.
One last question. And what protections are you taking to protect people on board the ship to keep it separate from the virus?
So I think the Admiral covered pretty well what the screening process is. So everybody is being screened prior to coming aboard. And if you are positive on the screening, you're not being allowed aboard. Obviously, we have full medical capability on the ship. If someone develops symptoms, to screen, evaluate with a qualified provider, test if need be. And the idea would be that we would not keep someone who's COVID-19 positive on board, either a crew member or a patient. We try to get them off the ship. So our role is really to work underneath the umbrella of FEMA and the state and local health authorities. So we'll take that direction from them. But we intend to be ready to receive patients the day after we arrive.
Before I say last few comments, I do want to get back on my testing question that was asked. I just want to make it clear that as Captain Rotark said, we do follow CDC guidelines, and the symptoms and history of the patient, when presented to a physician, a clinical decision is made on whether to test or not. So that doesn't automatically go one way or the other. It's a clinical decision that ultimately is made.
We're lucky we have a lot of highly trained, very skilled medical professionals, and we will follow their clinical judgment.
Right. So allow me and Captain Rotarek to say a few closing comments. Before I talk about the Navy mission, I would be remiss if not to remind everyone what we're hearing from public health officials in the CDC. Social distancing must continue for us all. I remind people to wash their hands for more than 20 seconds. Avoid touching your face. If you're going to sneeze, use an elbow or a tissue and clean the surfaces that you use on a daily basis. The men and women of the Mercy, as all DoD staff, serve a higher calling to protect and defend this country. With COVID-19, Navy medicine, as in any time our country calls, is delivering medical power to assist our communities in time of need. I could not be prouder of the men and women part of the Mercy crew. America should be proud as well.
Our Mercy team is ready to deploy and support FEMA and local agencies in their relief efforts against the COVID-19 pandemic. I have an absolutely amazing team, and I am truly honored to answer the nation's call to protect the health of the American people. Thank you for coming.